Hello, it is time to get started for our V-Slim webinar. My name is Kara Moncrief and I am the Clinical Communications Director for Sinclair North America. And joining me today, I'm super happy, is Aaliyah and Brockbank, and she is our Clinical Communications Manager. So her and I will both do the PowerPoint today. Many of you guys probably know Aaliyah is our social media queen and trends queen, so she's the perfect person to really speak on that. I am not I am not up to date on all of that stuff. However, I do know that buccal fat removal has been a huge trend, so it was definitely time to talk about it, and really like a lot of complications that come with it, that it is just that, a trend. But I don't think that the complications are really spoken about enough, unless you start going to YouTube and you hear a lot of the plastic surgeons that have stopped doing it. That's when you'll hear about it more. But we have solutions for those patients that are wanting a little bit more of a chiseled lower face. We have solutions for that. So we want to share those with you. I am going to share my screen and my PowerPoint with you guys now. Let me see from beginning. Okay, perfect. Okay, so we are really going to be focusing on a couple of our devices today to help the people that are coming in and wanting more of that buccal fat removal look. We're not so much promoting that surgical look, and we want to be careful with the patients, or I should say, I recommend for you guys to be careful with the patients that you're taking on as customers, and are they realistic? Are they just young and wanting to follow a trend where you're not going to be able to, maybe make them happy, or we'll discuss all of these things. But the good thing is that when we're using energy-based devices, that we're doing this in a very safe and non-permanent way. So we'll first talk about, let me put my glasses on, actually, sorry, I'm blind without them now. Okay, so we'll first talk about just our overall facial fat changes. And I went through this on another webinar I did, which was Sinker, Sagger, Wrinkler, that we have 3 types of aging. And I really hit on really all 3. If you're either a Sinker, a Sagger, or a Wrinkler, all 3 go through these changes. But the Sinker goes through them a little bit more dramatically, but unfortunately we all go through this. So we lose about 10% of our facial fat every 35 years, an additional 5 to 10% every 5 to 10 years thereafter. So unfortunately, when we look back at our photo, actually I should just take me and Aaliyah as an example, because you can see both of us on the screen, is that I'm 42, she's still in her 20s. There's a big difference there in the amount of facial fat that she has. I may not have wrinkles because I am in this industry, and I'm obsessed, of course, with getting treatments, but you can absolutely tell that I'm older. Why? It's not wrinkles that you're staring at on my face. It's just overall things that I cannot stop and that I cannot change. And a big part of that is a lot of my fat loss. So at 55 years, you may have lost 40% of your facial fat. So I'm not too far from that. So that's definitely why I have a much older look than Aaliyah does. The buccal fat pad appearances are less change. There's less of a change of this in our face as we get older. So actually, I'm going to go to the next slide and I'll explain it here. So we have different types of fat in our face. Some fat compartments that are superficial, and some fat compartments that are deeper. And when I say deeper, I'm meaning they're actually below the muscle. So the buccinator muscle, that the buccal fat is located actually underneath that muscle and in between that muscle and some other superficial muscles. So it's much deeper. And then we have more superficial fat, like masseter fat, like nasolabial fat. Let me move, my camera is in the way here. So what I want you guys to look at is the top photo of these two females. So the top photo is showing our superficial fat. So I'm just going to really discuss the lower face because that is really predominantly what we're ever treating on anyone, right? We're never wanting to do anything to anybody's facial fat that's high up because that's what gives us our youthful look. However, when patients are younger and they have a much much more rounded face than they want, we can do something for them. If somebody is aging older and they start to, I'm kind of skipping ahead, this is my next slide, but they go from the V-shaped face to the inverted V-shaped face, that's because we're starting to get issues in the lower face fat compartments that are superficial, meaning we can easily treat that. So that photo is showing all of those different compartments, and there's a lot of them. And then the photo below that is showing the deeper fat compartments, and one of them being buccal fat. And the reason why we know buccal fat so well, again, is because it's a trend to remove it. And then you have another picture here showing exactly where the buccal fat runs. And when they remove it, they just go through the inside of the mouth, find the pocket, and then just pull out that buccal fat pad. Okay, so now I added this slide to show, and by the way, there is a reason for our buccal fat, right? I mean, fat in general gives us protection to anywhere on our body. I mean, sometimes we have too much of it on our body and we don't want that, but especially in our face, you know, it does serve a purpose. But here I want to show you guys an example of, this is a slide from the last webinar that I did, an example of a sinker. So someone that just naturally is losing a lot of their fat in their face. And this is just a natural progression, but you could look at her young and then now and think that she had buccal fat removal because it's that apparent, that really like kind of gaunt, sunken in look that she has. But unfortunately, hers was just a natural progression. Would she have chose this? Probably not, because a sinker, I mean, they're going to look a lot older than they are just because of that fat loss. And there's a lot less that we can do for a sinker than we can do for a wrinkler or a sagger. They are going to need like the injectables. A lot of times they do need fat transfers. So actually that is, again, Aaliyah is going to talk about the trend, but when you're removing buccal fat and that trend goes out in 10 years from now, 20 years from now, and they've aged on top of it, now what are they going to do? Now we're doing fat transfers and it's never going to look the same. So this is a natural progression, but again, like she probably didn't want this because it does age her. And then you look at her youthful photo, and that round face is what gives her her youthful appearance. Okay.
All right, taking over. So we'll first talk about the purpose of buccal fat pad removal and then the controversy, the drama. So buccal fat removal can result in a slimmer looking face. And as Kara mentioned, it creates that desired V shape for patients, you know, with a round face who may not have that desired V shape. And so many aesthetic treatments, whether we really realize it or not, it has the end goal of that V shape. So kind of wider at the temples and more narrow and, you know, at the chin and in the lower face. This procedure is currently trending for another purpose, as Kara has mentioned as well. It's a trend, and a lot of celebrities are removing fat from this area to create a more chiseled appearance. So and we'll talk more about celebrities because they influence this greatly. But, you know, people and celebrities who are not necessarily a candidate, they don't really have enough facial fat here to remove in the first place, but they're actually kind of looking for that gaunt, chiseled look. They also call it like sucking through a straw appearance as well. And that's exactly what it looks like, honestly. So patients also—
sorry, did I go too fast? Sorry,
yeah, sorry. One more. No, you're good. You're good. Patients who have a larger masseter muscle they should be assessed for that first. If it is larger, a lot of the times that can cause a more round face. And if that's the case, all they need is neurotoxin in there and it slims the face really, really beautifully. So it is an important step before surgery, taking a bigger step. Okay, now ready. Okay, so the controversy. So we'll talk more about why it's trending, and Kara really touched on why it's mostly controversial, and it's because it does cause premature aging. This surgery, you know, it can be great for the right candidate who does have enough facial fat or enough of that buccal fat there, and as long as they're not taking too much away as well, because that can really really cause that gaunt hollowing too, as I just mentioned on that next one, and can prematurely age patients. So before, you know, if a patient is having this done in their 20s and their 30s, as we're seeing now, because it is so viral on social media, they have barely started aging. So they're just starting to age themselves before the, you know, natural aging occurs. And it's definitely something they could regret in the future.
And I actually forgot to mention something you just reminded me. It is something that they could regret in the future, like you said, because it's mostly younger. But something I did forget to mention is buccal fat is pretty constant throughout our life. Oh, wait, maybe I did mention that, but it is. They've done studies on actually using MRIs that our buccal fat stays constant where our superficial fat doesn't. So now imagine that, how Aaliyah just said, it will permanently age you. Why? Because that buccal fat actually stays constant to give us a more of a youthful appearance as they age.
Yeah, definitely. And results are permanent. So when kind of thinking of a younger demographic who we are seeing, you know, having this done right now, when we think back to when lip filler was first trending for really young people, or BBL, Brazilian butt lift, not broadband light specifically. There's two different versions of that. Those things are ultimately reversible. Sure, one is like a surgery you would have to undergo, but easily, you know, dissolve lip filler. So when the trends change, you know, or they don't like how they look any longer with those things, they can reverse it. And that's really not the case with buccal fat pad removal. So, and Kara touched on it as well. This is a tricky area to restore volume. So HA filler is not a great option in, you know, in the lower face. Most of the time, the best option is a biostimulator such as Sculptra, of course, our energy-based devices. But as she said, it's not necessarily going to completely restore the volume there. So they can still definitely have that hollowing.
That's a huge problem. And they do, like, they'll do fat transfers, but again, it will never look the same.
Same, yeah, definitely. All right, let's talk about the trends. Why is buccal fat removal trending? Well, first of all, we're going to talk about aesthetic trend controversy in general. So it's kind of been brought to the public's attention, I'll say, that women's bodies have really become trends. And this honestly isn't really anything new. I think it's just, again, people realize it now. I recently realized it once, you know, it's been pointed out, and I'm like, oh my gosh, it's so true. So if we think back to the 90s and 2000s, early 2000s, it was very popular and very trendy to have a very thin figure. Sure, we all remember that time. Paris Hilton at the bottom there, she's a perfect example of what was trendy back then.
Mm-hmm.
We fast forward to 2013 to 2020, it's really when the BBL was like at its peak, when it was at its most popular. It was listed as a, you know, a trending cosmetic surgery. And really the Kardashians put this treatment on the map. I'll be talking a lot about the Kardashians. Sorry if you don't like them, but they really are the pioneers of social media and aesthetic trends and celebrity influence in general. So we really saw the BBL, you know, there was a huge deal because of them. Yep. Now we see social media says that BBLs are over. Is it still a popular surgery? Yes, of course. But I think it's moving more so in the direction of a more natural look versus when, you know, it first kind of came out and was really trending. It was really popular, you know, for it to be more accentuated. They're saying that celebrities, again, like the Kardashians, are having reductions. Ozempic is incredibly popular. We just had a webinar on that. So weight loss drug, buccal fat removal, of course, and it's really trendy again in that bottom right-hand picture. It's very trendy again to be very, very thin. So social media, body positive influencers have really pointed out that women's bodies have become trends, and trends always come back. So I think we really have a huge advantage in non-invasive medical aesthetics because we are able to improve on so many different patient concerns without, changing them drastically to where they will regret it, in 5-10 years when the trend does change. But we are still definitely changing lives, with what we're doing, just by improving on so many things non-invasively. So we definitely have a huge, huge advantage there.
I so agree. And I think too, it's talking to your patients, right? It's making sure they know when they're asking for things like this. Maybe you're not a plastic surgeon on here, but you do have all of these other treatments to offer, and they're considering this. I would be really open with talking to them about this. Think of the trends that happen. Talk to them about aging. When we're in our 20s, it's the last thing we think about. Mention that buccal fat will stay constant. Your superficial fat's going to go away. And I would really just make sure your patients are looking at this in the reality of it.
Definitely.
Oops, yeah. Sorry, I didn't open up the slide all the way.
It's okay. Yeah, they're intent on why, they're seeking out. Really, we will always want to know their goal for any sort of cosmetic aesthetic treatment, but surgery specifically, like, what's your intent? Is it to follow a trend, or has this thing bothered them for a really long time?
Exactly. And is it a real issue?
Right, exactly. So why is buccal fat removal trending? TikTok. Really, if anything is trending these days, it is most likely thanks to TikTok. When I was doing research on buccal fat, I wanted more clinical information about it, but I had to sift through so many different articles about the surgery. I'm like, oh my gosh, I just want to know about the buccal fat pad. So it's definitely spread further than TikTok as well. So on the platform, the hashtag buccal fat removal has 135.5 million views. Buccal fat has 48.4 million. Buccal fat pad removal has 5.1 million. Actually, these numbers have grown since I made this slide, so it's still a topic and it's still growing. And really, in general, social media has greatly influenced the aesthetic industry, both surgical and non-surgical. And there's actually studies that show the more someone uses social media, the more likely they are to consider some sort of cosmetic treatment. And it makes sense. We're really able to educate patients on what we have to offer through social media. I was on Instagram the other day, as always, and a plastic surgeon that I follow came up, and he was posting about a surgery that's relatively not unknown, but maybe to the general public. It's hairline lowering surgery to reduce the size of your forehead. That's why I follow him in the first place. But there were people in his comments that were like, oh my gosh, I had no idea this was something you could do. Like, my forehead has always bothered me. And he was in his comments responding to these people saying, great, we'd love to see you for a free consultation. Here's our phone number, please call us. So we're really able to tell patients and give them solutions to their problems being things that bother them. They don't know that, we have a non-invasive solution to buccal fat removal. They may not even know what surgical buccal fat removal is, but they know that their round face bothers them. And we're telling them, like, hey, there's a non-invasive solution, which is incredible.
Yeah, so, I love that.
Yeah, just telling them what's out there. That's how you learn. That's how we learn these days, is social media. That's how I learn anyway, about many different topics.
No, I think it's so good.
Yeah, it's really important, obviously, to know what's trending in the non-invasive side of medical aesthetics, but it's good to know what's going on over on the surgical side as well, because there will be patients looking for non-invasive options, and then you can market this treatment that's trending, and then you can easily attract them. Really quick, I'm going to kind of circle back to TikTok for just a moment. The average age of TikTok users is 18 to 34 years old. And with buccal fat removal, being permanent, as we've mentioned, and the app that made it so viral currently, having such a young demographic, which we've talked about, it's kind of a dangerous combination. Again, they are not thinking about aging in your 20s and 30s typically, maybe
Mhm.
more so now than ever. But it's a dangerous combo for sure. So I think it'll be interesting to hear the conversation about buccal fat removal in coming years. Do people regret it? Do they still love it? What's their aging process look like? It'll be really interesting.
And that's what a couple of the plastic surgeons, like if you look up buccal fat removal plastic surgeons, that a lot of them have done a lot of videos, and that's what quite a few of them have said, that they've talked to a lot of plastics that completely stopped this procedure. And the reason being is, okay, we do not have enough research on what is their aging process going to be like when they get older. But they're smart, right? They're doctors. They can foresee what the aging process is going to be like, and most likely it's not going to be good.
Yeah, definitely. I think we'll have a lot of future sinkers coming up.
Yeah, exactly.
In like 30 years or something for sure.
Yeah, no, you're right.
Another reason why buccal fat removal is trending is celebrity influence. And this is really nothing new either, but just with social media, we have the information is more accessible. The information about what celebrities are doing, whether they're sharing it from personal experience and it's like a paid thing, or if it's just assuming, right? If you follow e-news or something. Sorry, just a sec here. There we go. So Chrissy Teigen has really only been the one to come out and say forthright that she's had this procedure. She's in the middle there, and she was a decent candidate. And you can see she just has more of that V shape. Now we can really see, Leah Michelle on the left, and on the right, I completely forgot her name, but I believe she's Leah Rena's daughter. We see that really gaunt appearance. And when they just randomly show up one day and they look way different and really hollow in this area, that we can kind of assume that they've had that procedure. Going back and talking about the power of the combination of social media and celebrity influence. If anyone remembers, in 2013, when Kim Kardashian posted a picture of her after her vampire facial. If anyone remembers that?
Yes.
I couldn't believe it was 10 years ago. I thought it was like maybe 5, but I was like,
It's crazy.
Yeah, that treatment absolutely blew up. It was a shocking picture at the time. Her face was bloody. It got a lot of good press. It got a lot of bad press, but press is press. So it really put that treatment on the map and really skyrocketed it to mainstream popularity. It was all about the vampire facial for years. Now it's still a very popular treatment. Now we don't necessarily use that term any longer. It's more like PRP microneedling or PRF, whatever the case may be. But that really is the power of social media and the celebrity influence.
Yeah, so true.
Yeah, they definitely change and continue to change the trends in aesthetics, 100%.
Yeah. And going back to that slide, just looking at that photo on the right, it makes me so sad. Like, I get it with Chrissy Teigen, she's always had that rounder face, but she was still a supermodel, like still
Right.
so beautiful.
Definitely.
But I forgot her name too, the one on the right.
I think it's Amelia or something.
She couldn't be more beautiful.
I know.
She couldn't, I mean, perfection. Yeah, it's unfortunate.
Yeah.
Okay, but we do have solutions that are not going to be that dramatic surgical. There's no, coming back from treatment, and it's looking at the treatment. First, we'll look at the treatment demand. And there are going to be candidates out there, like I was mentioning, and Aaliyah's mentioned. You will have clients that are in their 20s or 30s that have a much rounder lower face and that do want to do something for that. I completely get it. And we do have a solution for them. And usually it's going to be younger clientele that are even going to be bringing up a buccal fat removal to you, typically. But then we also have the patients that are in their 40s, 50s, and there's also starting to have fat issues in the lower face just by aging. Right. And we can help address that superficial fat to bring that beautiful V shape back up and still give a contouring appearance. I mean, we do have protocols for like chiseling the jawline, which we didn't add the VST. I'm sorry, chiseling the cheekbones. We didn't add the VST in here, but I'll make sure to mention that at the end on how we do that, how we can really contour the cheekbones, and that alone gives more of that appearance of the removal of buccal fat. Okay, so I'll just kind of skip over this. I think I talked enough. Yeah, it's pretty much everything I said. So, and then a slide here of what do we want, and then what do we end up having as we age, right? That perfect V shape, but then we get the inverted V shape as we age. So two totally different types of patients, right? You're going to have the younger ones that want more of the high fashion trend, sunken in look. Of course, we can contour them if they need it. Again, I would be very particular with your patient selection. As always, right? We're always making sure that we're picking the right patient for the right procedure. And then we also have the patients that are going to be older that do have those issues as well, but just, you know, very different, where we need to help address the fat that's starting to drop more. So one of the technologies that we have to address this is the V-FORM, and the V-FORM can go on our platform device, the V10, the V20, or V30. It is radio frequency based. So radio frequency and what it's doing. So radio frequency is, well, it can do a couple different things depending on where we're putting the heat in the body. So with RF, our body doesn't recognize it. It's something foreign to the body. So it actually has a rejection process, which in turn makes our cells move around and generate heat. So really it's a heat-based treatment. Now, where are we putting that heat? Are we keeping it superficial in the dermis for collagen building, or are we putting it deeper into the fat? So we know with our core technology that we can really control that depth of penetration to be deep in the face. And the reason being is that we have different frequencies that can go deep into the hypodermis. That's where our fat is. Or we can keep that heat superficial where the collagen layers are. So when we take that heat deep in the dermis, what are we doing then? We are stimulating lipolysis. Lipolysis is taking in large fat cells and, in a sense, shrinking them down, dehydrating them and making them small. So great. We're not doing this in a surgical way. We're doing it in a very safe way, but still contouring the lower face. No downtime, no risk of infection, affordable for the patient, not scary like surgery would be. And it's just that them knowing, like, do they know that this is an option? And a lot of the younger clients don't. Now, I say that, but a lot of the younger clients do because they do their research. But do they know that you offer it? Maybe not. So if you're not highly motivated on social media, I hope that this webinar will help, because like Aaliyah had mentioned, the buccal fat removal is popular amongst what ages? Younger, right? Where are they getting their information? TikTok. So don't just do Facebook. Don't just do Instagram. Target your younger clientele on TikTok and making sure that they know that there is a non-surgical solution, that a lot of times they want to jump on board with that, because a lot of people just don't have the money to be able to even afford the buccal fat removal when they're that age. And again, it's also surgery scary too. So making sure that they know this is an option. So again, V-FORM has core technology. We can control the depth of penetration. We can be deep. We can shrink those fat cells. We can make them nice and small and have a contoured appearance. The V-FORM also has a vacuum. And what the vacuum is doing, it's also pushing the heat deeper. So that's going to be a huge aid in making sure that we're able to get all the way through the fat pad, to shrink all of the fat in the area. Additionally, it increases microcirculation. And when you do that, so what's happening is when it goes through lipolysis, the fatty acids, the liquid in the fat cell comes out of the fat cell. And then our body, it goes into the circulatory system because it's energy, right? Fat is energy. So it goes into the circulatory system and then the body burns it as fuel. Great. Our body's just naturally breaking down that fat we don't want. We're just giving it a little push and helping it with the V-FORM. So the body will naturally burn it for energy. So that's why we want to increase the microcirculation, because we get a jump start on that process. So the vacuum does that. Really important to have a vacuum with RF if you're doing anything with fat. Additionally, we increase lymphatics. So any excess fluid in the area that makes this look even rounder on the lower face, it will calm that down just by pushing that excess fluid through the lymphatic system. There was something that I had forgot that, another thing is, I'll go back actually. Not only can we go into the fat to decrease the fat in that area that they don't want, but we can keep it superficial to help build the collagen. And where that's important is making sure that their skin is nice and strong and thick, because as we remove the fat volume, we want to make sure that we're never getting laxity to the area, especially as they age, right? So we can keep the heat superficial at the same time to build collagen and shrink the fat, so they don't have laxity and the fat issues are gone, especially if you're treating patients over 40. So the protocol is, we're going deep into the fat for 10 minutes. We're just keeping a certain temperature, 39 to 42 degrees Celsius. Once that's done, we're just doing 2 minutes in the reticular dermis, which is collagen, and then 2 minutes in the papillary dermis, which is collagen. So again, just giving a boost to that collagen to tighten the tissue and thicken the skin. Now, how many treatments would they need to really get that nice appearance? I would say it really varies, right? It's going to vary so much from the patient, the age, the health of the patient, how large the face is, how much maybe fat, if their fat issues is because they're older, how much fat has kind of gathered in that lower face region. But it's typically anywhere from 4 to 8 sessions. And I mean, you'll get a good idea on about how many treatments they'll need as you're doing these treatments more and more. But, to be safe, you can always sell a couple treatments, too many, because it's never going to go to waste, because we always like to do maintenance every 3 to 6 months. And then the treatments are every week, which is amazing. So you think about that. If they only need 4 or 6 treatments, they're seeing the results within a month. They don't have to wait a long time to really, really be happy with those results. And even buccal fat removal, they have a lot of swelling after. So it takes a while to start seeing the results. With this, there's no swelling, and they see it even after the first session, they see it, but they really see it after a month, and they're going to be extremely happy.
Yes. Also with surgical buccal fat pad removal, they're just removing right here. With the V-form, we're able to come all the way back, all the way to the masseter, the jawline. You could even hit the submentum if they have fullness or laxity there. So we're really covering, starting right here if they have jowling. So really covering the full lower face.
I'm so glad you said that. We can even take it. So we have a fat pad here called the nasolabial fat pad, and that gives so many complications as we age. So if they have jowling, we can treat here. As Aaliyah mentioned, we can even take it under the jawline for submental issues too. But as we age, that nasolabial fat pad starts to drop in kind of forward and down. So we can even take the V-form right into this crevice. We don't want to get into our fat pads here. We have about 3 or 4 here. That we want to keep. But the lower nasolabial fold fat pad, we can absolutely treat that. And again, if we're keeping it right below the cheekbone, it's going to just naturally give us that beautiful contour, higher cheekbone appearance. And if we take it both lower face and under the jawline, that's just going to give us that sharp jawline that most people want as well.
Yes, such a good option. And it feels good.
Really. And it's comfortable. And now, so we're talking about 2 technologies. Why? Because we're all about combination, right? The more you combine, the quicker the results, the better the results. So always keep that in mind. Combination approaches are going to get them there faster, and usually they're much happier with it as well.
Definitely. When I was looking at what's trending in aesthetics recently, combination therapies was one of the top. So
nice.
Very important. Yes.
Yeah.
So next we'll talk about the Dermafuse. So this is done after each V-form treatment. It's an additional 5 no longer than 10 minutes in such a small area. It really adds great value to each treatment. It's just a boost to results ultimately. So Dermafuse uses proprietary Nobel Prize winning technology called ion fuse. And this doctor years and years ago wanted to find a way to penetrate skin cells without needles, without injections. And that's exactly what Dermafuse does. It creates optimal skin cell permeability by using electrical current, which rearranges the lipid bilayer of our cells, basically to make it all hydrophilic, water loving. So we're creating microchannels into the skin. Our cells are opening up. So the serums that we're using aren't just going into the epidermis and just kind of floating around there. We are getting specific into cells that need the particular ingredients we're using, which is incredible. It's one of my favorites. We do have 5 different serums, and I want to add really quickly before I move on, those microchannels are very short-lived. They close up immediately after treatment's done. So it's completely non-invasive, zero downtime whatsoever, which is really nice. We have 5 different serums. Today we'll just be talking about one of them though, because that's what goes along with the V-Slim protocol. But if you're not familiar with Dermafuse, we have one for collagen booster. It's great after any skin tightening treatments. Intensive hydration for dry skin, also incredible to prep the skin for any RF or laser IPL treatments, since they're all attracted to water. We have smooth for acne, bright for hyperpigmentation, treats melasma beautifully. So a lot of these serums are corrective and are great in conjunction with your aesthetic treatments to prep the skin before, but also by themselves and for maintenance as well. So you can do Dermafuse anytime in your life, honestly.
Yeah, no, I love that. And I also want to mention the microchannels. As Aaliyah said, it doesn't just go in the epidermis. It actually has the ability of going 10 centimeters deep. I mean, that's deep. So where that's important is our next slide. She's going to talk about Lipo Limb, but you are guaranteed that you're going to get into all of the adipocytes, all of the fat cells in that area because of the depth of penetration.
Yes, so great. And really high absorption too at that, at each depth of penetration too. So Lipo Limb, this is what we're using after each V-Form treatment in this area. And just to kind of add, Kara mentioned this, we don't want to take this serum either, on the cheek or anywhere else but this lower face in the submentum area. We don't want to reduce fat anywhere else on the face. But it is a powerful anti-cellulite and body sculpting complex. So of course, a lot of the times we're doing body contouring on the face, but it of course assists in facial contouring and reduction of gels as well. Gelling is just fat accumulation in the lower face. It encourages that lipolysis, as Kara mentioned. She mentioned what that is, shrinkage of fat cell, dehydrating that fat cell. And it also prevents future cellulite formation too, if you are using it for the body, but we're talking about the face here. So our ingredients, first one is Chenopodium quinoa seed extract. Quite a mouthful. It's a high quality plant extract. And what this does is essentially when our fat cells mature, they grow to a large size, they tell other fat cells to also mature, which is quite rude if you ask me. It restricts, it kind of stops that signal from happening. And it also restricts blood flow between the fat cells. Our cells, our body, our organs need microcirculation and blood to be healthy. So by restricting that, we're helping that lipolysis process and helping to keep that fat cell small. And again, this ingredient is going into the fat cells themselves directly. Then we have hydrolyzed collagen made from deep sea fish, which is a really, really great form of collagen. And as Kara mentioned, we never want to trade one problem for another. We never want to leave patients with loose, lax skin after reducing fat. So that is why this ingredient is also in the Lipo Limb. Although our main goal is to target fat and to shrink fat cells, we always want to tighten the skin. So we are driving this amazing form of collagen into the fibroblast cell. So not only is it providing or producing collagen, it's also producing really healthy collagen and elastin. Then we have sodium hyaluronate. This is a stable form of hyaluronic acid. This is kind of just a cherry on top ingredient. Anytime our skin is hydrated, which by the way, hyaluronic acid holds 1,000 times its weight in water. So it really attracts water. It's really prevalent in our extracellular matrix in our dermis. So anytime our skin is hydrated, it will just always look better, look more supple. So overall patients are just happier with their results, by adding that collagen and that hyaluronic acid.
Love it. That quinoa seed extract, if you guys ever Google that, it's unbelievable what it does. I mean, it truly, you have to think about the V-form is going in and stimulating that lipolysis, taking those enlarged fat cells, taking that fluid out of them, making them small. And then if you go in immediately after, so it's the same day, immediately after, and put that quinoa seed in, that is just telling the cell even more so to break it down. So you can almost think of it as when people added the Dermafuse to their practice, the emails that I would get of how happy they were with their clients with all the treatments. But I even heard it because Lipo Limb, we didn't release Lipo Limb right away. So when people purchased the Dermafuse, they didn't have this serum. Then we added it later, and that's when I was getting the emails like, listen, I wasn't really sure, but I tried it with my contouring patients and they were truly blown away. It's almost like getting your results doubled with using that ingredient. It is incredible.
Amazing.
Okay, I added another slide. I couldn't stop when I was, Elliot's probably like, wait, this PowerPoint looks completely different.
It's new to me too.
So as I was researching, there were more and more celebrities that, the only one, as Aaliyah mentioned, the only one that's come out and said that they actually did the buccal fat removal was Chrissy Teigen. The rest of them were just guessing, right? But with Sophie Turner has always been tall and thin. Like she's never really fluctuated in her weight much. She's always just been a tall, thin girl. But then all of a sudden she had a very different appearance. So again, like I can't say that she did the procedure, but there is an appearance that she did. But I just want to point out, not knowing if she did or not, on the left and then on the right, you would probably think that was a 10-year or more age difference. She's 27 years old today. She's 27 years old. I know. So again, I would really stress talking to your clients about this if they're ever considering it. Like, listen, the aging process that it does to your face. I mean, we can do it in a non-invasive, very natural, beautiful way. Or you can, potentially get into this where you look 10, 15 years older, and then in 10 to 15 years, what are you going to look like, So I just highly recommend I would do the same if a friend called and asked me about it, listen, there are other solutions out there. So I would urge, to do it with your clients as well. Now, that being said, let's say Sophie Turner comes into you. She's already done it. Okay. Now the trend's over, or maybe the trend's still popular, but she's now noticing like, okay, I look a little gaunt. I look aged and I'm only 27. Now what can you do with maybe complications that they have? And by the way, there are a lot of complications with the surgery too. Like if they accidentally get into a nerve that they can't, the lip won't lift all the way. If they accidentally hit a nerve on this side and maybe not on this side, that when they talk, the lip doesn't lift quite like it used to when they spoke. So there's a lot of complications with the surgery too, but let's not talk about those because we can't fix that. But I was just talking about complications in general, but they change their mind. They don't like the appearance. Now what can we do? Or now they want to do some age prevention. There are things that can help the appearance of that, and that is by building their collagen back up. Because remember, collagen is our scaffolding. It is our structure, our strength to our skin. So if we can thicken that, then we can just overall help that gaunt appearance to the skin. And also, the more hydration we have in our tissue, the fuller our skin is. I know I've spoke a lot about this on different webinars, and that's turgidity. So what is turgidity? It's when you don't water your houseplant, what happens to it? Then we give it water, then what happens to it? It has turgidity. It comes to life. It actually raises back up and it plumps back up. We can do the same thing to the skin. So it doesn't necessarily mean that they would have to do a fat transfer to their face. We can make that area look a lot better just by using these energy-based devices. So we have the VFR or the VST, both radio frequency based, both amazing for building collagen in the skin, again, thickening the skin so it doesn't have that appearance as much. I talk a lot more about that in my Sinker, Sagger, Wrinkler webinar. So if you haven't watched it, I recommend, because people that naturally are sinkers, I have quite a few slides on things that will help them to help prevent that look. And then additionally, Aaliyah mentioned this, that we have multiple serums with the Dermafuse, not just the Lipo Limb, and one of them being intensive hydration. That is primarily HA, hyaluronic acid. And HA, it's a glycosaminoglycan. These are just as important to our skin as collagen is. Glycosaminoglycans give us that, again, that turgidity, and HA is so important. That's why you're always hearing it like in commercials for skincare. It is that important to our skin. But we can take this pure HA and drive it deep into that extracellular matrix of our skin and plump it back up. That's huge, and that's immediate. And it doesn't just go away the next day. It really stays. And the reason why it stays, by the way, if you guys have the Dermafuse and you're like, why do these results stay for so long? If we're just putting HA, doesn't our body, just metabolize it? It goes away. And the reason being is we have another ingredient in that serum. I just forgot the name of it.
Saccharide isomerate.
Oh, say it again.
Saccharide isomerate.
Yes. Saccharide isomerate. Gosh, I haven't talked about that ingredient in a long time. Saccharide isomerate. It binds to the keratinocytes, which are our most superficial cells in the skin. They're in the epidermis. It binds to that like glue, and its job is to create a barrier in the skin. So it creates a barrier so the HA can't escape. It's trapped in there, which is great. That's what we want. So the results are really long lasting, and they can come in monthly to have that like beautiful bounce back to the skin. I know I spoke a lot about having acne growing up and therefore always suffering from acne scars. And I was just talking to a friend of mine who also has acne scars. I'm like, gosh, you drink a ton of water. And I try to be good too, but she's really good. And she said, the reason? It's my acne scars. The more hydrated I stay, the less that you can even see them. When I stop drinking, you can see them a ton. That says a lot. That says a lot about HA, about water, about hydration in our skin, that it can go that far to even like you can't see acne scars to, wow, the acne scars you are very apparent. So even that can help that gaunt, sunken in look, and then building up the collagen. So hopefully they wouldn't have to do like a fat transfer in the future, but of course that's always an option, or injectables. Well, you guys, if anybody has any questions, you guys are more than welcome to unmute yourselves or write into the chat. We can stay on a minute, see if anyone has any questions. If you don't have our products and you are interested in the things that we have discussed, you can easily just scan that QR code. It will take you right to our website. If you have any questions that you would like, I don't know, longer question, or maybe something that you think of after the webinar, you can always email us, or if you're a big social media person, you can always direct message us. So that's our social media handle at the bottom, or you can always old-fashioned call us, 888-415-1192. Who does that anymore? We would love to talk to you.
Oh, it's right here. I thought you knew it off the top of your head.
Oh, I do. I've said it 1,000 times that I do. The video is probably covering it like it's covering it for me.
Yeah.
Yeah. But yeah, you can old fashioned just give us a call. We would love to hear from you guys. But any questions? No. All right, I guess we'll wrap it up. We really hope that this was beneficial, and knowing that there's always a non-invasive solution for anything. I mean, I guess other than like the BBL, I don't know if we wouldn't be able to do anything for that if they wanted a Brazilian butt implant. But almost anything that's trending, almost any issue that someone has, we have that solution. We have it in a minimally or completely non-invasive way. We have it to where it's cost effective both for you and for the patient. We have these amazing combination treatments put together already for you guys to make sure that your patients see results quickly and that they're really happy. So if you already have our systems and you want to hear more about like combination treatments for any condition, you can always call or email us. We're happy to go through those combinations. Okay, we did get a couple questions. Yay.
Someone asked how much to charge.
And can you do it without Dermafuse? So yeah, absolutely, you can do it without Dermafuse. If you don't have Dermafuse, I recommend you get it because it really is all the hype that we're talking about. It really is amazing. But if you don't have it yet, yes, 100% you can. The V-Form does a beautiful job at contouring the lower face. Really beautiful job. And oh, and that's what I was going to mention too. If you also have the VST, what you can do, a really nice protocol, especially if you don't have the Dermafuse, you can contour this area, and then at the very end, you can take the VST starting right at the top of the nasolabial fold, right at the corner of the nose, and doing 2 rows, just go under like a Nike check mark under the cheek area and then up. And that will give a beautiful contour that will give that appearance even more so, right? Because the larger our cheekbones are, the softer this is. So first contour with the V-Form, then contour with the ST, just to give it a little boost. I'm getting lots of questions, or we are getting lots of questions now. Okay, how much to charge? I would say if you're doing a combination of, well, I'll just talk about individual pricing and then if you put them together. So V-Form lower face is typically around $300 to $400 per treatment, and then you would just package that together. I would say the lowest I ever see it is like $200 per treatment, but typically around $300 to $400 per. Dermafuse, I would just do Dermafuse as like a boost, an add-on for anywhere from $50 to $100 as an add-on. And it just, it varies on your time and so on and so forth. So you can do easily $100 if you want as an add-on. And then you just package it together. And of course, with packages, you can do a discount on that. Thank you so much for sharing this non-surgical approach and also how to improve a gaunt appearance. Yeah, of course, Stacy. Thank you for being on. So it's the V-Form and Dermafuse duo. Yes, so that's what we recommend is doing the duo. It's the V-Form contouring protocol once a week. And then if you are doing the Dermafuse Lipo Limb, they may not need as many sessions. So if they typically needed 6, they may only need 4 or 5. But yeah, you would do it in the same day, same sitting, V-Form first. The reason why we always have to do V-Form first and then Dermafuse is once we put those ingredients into the fat cell, we want them to stay there to do their job. If we did the Dermafuse Lipo Limb first, and then we went in with RF and vacuum, we would just push it out of the fat cell. So we want to lock them in, lock those ingredients into the fat cell. Can't get serums in Canada, have the device. Which mode for VST or for ST? You will be able to get serums very soon. We are like opening up Canada now with all of Sinclair. So there's going to be a lot of movement. We're even planning potential events coming up this year, and we are getting our website for purchasing up and going. Actually, we were just emailing about it a week or two ago, so you will be able to get serums very, very, very soon. Call us actually and chat with us about it, because it may even be up and running by now. Which mode for ST? It depends on their age. So just, you would use the same modes as you would if you were treating their full lower face. Okay, can I rewatch this webinar somewhere? Yeah, for sure. We always upload them to YouTube. And we also always upload them to our customer portal on sinclairshop.com. So sinclairshop.com, customer portal, the recording will be there, and then on YouTube. After buying the V20, how can we get the code for the Sinclair app to be able to enable the course? Maybe the trainers will give it to us. After buying the V20, how can we get the code for the Sinclair app? We don't, unfortunately. I don't know. Are you in the US? Maybe if you're outside of the US, let me know if you're in the US. We don't have an app in North America. But you can always, yes, US. Oh, Puerto Rico. Okay, we don't have an app. We wish we did. Not yet. But you can always rewatch these on like YouTube and on our customer portal, if that's what you were asking.
And my Sinclair College as well. It'll be there.
True. I forgot about that. Yep.
Lots of places.
Yeah. I'm hesitant to pop off. Just
I wish it told us the little bubble that comes up.
Yeah. No, I love all these questions. They're great, and they're usually what other people are thinking too. So I appreciate everybody writing in. All right. Well, it's getting quiet. So we will sign off. Thank you. First, Aaliyah, thank you. You did a tremendous job. I learned a lot as usual from you. So I really, really appreciate you being on and helping with this. Oh, thank you. And then everyone that joined today or tonight, depending on where you're at, thank you guys so much for being on. We really appreciate it. Aaliyah and I will be doing quite a few webinars coming up. We want to do one every, is it 3 weeks?
3 weeks, yeah, trading off.
Every 3 weeks, and we will, yes, as she said, we'll be trading off. So Aaliyah will do one 3 weeks later. I'll do one 3 weeks later. Aaliyah will do one. And we really want to cover a lot for you guys. So I'll be more clinical focused. Aaliyah will be more social media and business development focused. So, you know, both being equally as important. And we're trying to think of like lots of really creative and good ideas to help you guys out as much as we can. So looking forward to seeing you guys on the future webinars. And thank you so much.
Thank you. Bye.
Bye.